Welcome to the Ask a Therapist podcast, where we talk with medical experts about mental health and some of the stigma surrounding it. I'm one of your hosts, Sean Jackson. Today we have Dr. Brian Steele, a psychiatrist, consultant, and telepsychiatrist. Thanks for joining us today, Dr. Steele. So whenever we're doing this quote-unquote building or construction, how much should men be doing on their own versus maybe seeking advice or even going to therapy?
So there are things for your mental health that you can do on your own. There are lifestyle changes that you can make. But there are times when things get bad enough that doing it on your own is not a good idea. Severe depression can lead to acutely dangerous events. And men, again, are 4 times more likely to commit suicide. And so seeking help is kind of like getting a plumber for help with the pipes that you tried to fix and they're still leaking. And it's a good decision. Get some professional help. Medications help. And so psychiatrists and primary care providers can help you find a medication that can help you get out of the symptoms that you're dealing with. Therapists can help you use brain processes and techniques that will help get you out of some symptoms that you're dealing with. Unfortunately, you can't just lift your way out of depression sometimes. You're going to need to do more than just lifestyle changes. You're going to need to seek professional help. And it's okay to do that. That's what the field is there for, and it should be able to help you with your symptoms.
It's really powerful to understand that it really is okay. We spoke earlier about how men are much more likely to experience mental health issues, but equally just as likely to not seek out solutions for those issues. So what would you say are some things that men should look for to know that it's probably time to go talk to someone?
So some early warning signs of dealing with symptoms of depression and anxiety sometimes is difficulty sleeping. Men will often have a more irritable edge, so be a little bit more edgy around family members and, sometimes verbally snap at people and being out of character for them. Increased use of alcohol frequently follows getting depressed, or increased use of substances. And so those are some of the early warning signs to look for. Seeking a professional's help. There's so many ways to sort of get an assessment these days and interact with a professional and ask them their opinion if these symptoms are a problem. If you feel comfortable, you could ask your family, have you noticed any changes in my behavior lately? Do you think I'm depressed? Have you noticed anything that has you concerned about my behavior or how I'm acting? And so that's one way, is to ask your family if they've noticed anything differently. But as far as seeking treatment, there's a lot of different treatment options, particularly these days, that can be less threatening. Sometimes people feel a little bit uncomfortable going into an office. And if that's you, you could use an online platform. There are multiple online platforms, ZocDoc, Teladoc, and those things can allow you to interact with a provider from the comfort of your home and the security of your home and tell them what's going on and get an idea. There are standardized screens sometimes that are used where we'll give you a series of questions and determine from there how severe symptoms are and if treatment is indicated and what the different options are.
Yeah, I really feel like if anything positive did come out of the pandemic, is all these alternative treatment options that are available now, especially for those men that already do struggle with admitting that they have problems. So how common is it for men to have mental health struggles in today's post-pandemic overworking lifestyle?
So many experts will tell you that men are just as likely to have all of the mental health problems as women. We know that men are more likely to have substance use problems. We know that they're more likely to have neurodevelopmental problems, so autism and ADHD. They're statistically more likely to have those things. It's possible that they're more likely to have depression as well. Even though we see women present more, we know that men are 4 times as likely to commit suicide. And that tells us that there's something wrong in how we're studying the likelihood of men coming in for depression. So it seems like men just aren't coming in. And so it takes strength to go seek treatment, because a lot of men don't. And so by going and getting treatment for depression or anxiety, you're exhibiting a strength that's not as common as we would hope that it would be.
Dr. Steele, all this has been really great advice. I just want to end today by asking, when would you say is the right time for men to start focusing on their mental health?
Because prioritizing mental health is an important lifestyle change, the best time to seek treatment or change things to prioritize your brain is now, the present. People deal with mental health problems throughout their lifespan. And so there are specific problems that people deal with when they're older. There's higher risk in older men, for instance, of completing suicide. And that kind of tells us the importance of prioritizing our mental health at a much earlier point if we can. But there's no time like the present to seek mental health treatment on an organized basis and to make lifestyle changes that can impact your mental health.
Thank you so much, Dr. Steele, for joining us. And thank you to the listeners for tuning in today. This has been Ask a Therapist, a Blue Cross Blue Shield of South Carolina podcast where we dive into mental health topics. Be sure to check out other episodes of Ask a Therapist for more mental health advice, and we look forward to seeing you on the next one.